Hi, this is Nurse Kathleen. Can't breathe, shortness of breath, mucus, phlegm, a lot of coughing? Well, I'm here to help. Lungs are one of our defense mechanisms used in our immune system. We have many defense mechanisms. Actually, the largest one is our skin. But today we're going to talk about the respiratory system a little bit and the lungs. Mucus is a normal part of our system, our defense system. We need it to line certain parts, cavities of our body and our mouth, throat, nasal, so on. But excessive mucus is a problem. And so that's something we're going to talk about today. We're going to talk about some preventative things, also some self-care and things that will help us where the duration of what we're going through, whether it's an allergy or a cold or a virus, the duration of it and the intensity of it, we can shorten that. So I'm going to give you some tools for the toolbox. And if you wait until the end, I've got 2 bonuses for you to show you how to actually bring it up. We've done it in hospital settings for years, and I've done it on myself, I've done it for family members and for others, so it works really well. So please stay to the end. Some of the things that impair our respiratory system to act like it should are things like poor choices like smoking, poor diet or nutrition, as I like to say, bad posture, the environment, allergies, stress, bad habits, things like that. And these are things that we can correct and we can improve, and that's what I'm here to talk. The average adult breathes about 18,000 to 30,000 breaths per day, and that's just the average adult. As I said before, the respiratory system also works in correlation with our cardiovascular system, heart, lung, lymphatic system, all these systems in the body. So it's really important that it works well and it works optimally. I've been getting a lot of questions about coughs, mucus, RSV right now is pretty rampant in areas, not really here in Florida that I know of, but in other areas, and it's been around for a while. It's nothing new. So since I've been getting a lot of questions about that, I thought I would speak on that. And I want to tell you a personal story of something that happened to me and what I did about it. And we did it through natural means. I tried other means that didn't work well. And so I'd like to tell you about my personal story. So about 11 years ago, I developed pneumonia, and I was eating right and doing the right supplements and everything, and I contracted it obviously from, I think, from stress. So stress really lowers our immune system. We can build it, but if we get stressed out, it drops our immune system and it puts us at risk to get whatever's going on out there. So I developed pneumonia. So what happened was I tried some natural things, but I wasn't really consistent with it like I should be, because I was taking care of others and still, I was still a nurse and all of that. And so it developed to where I got kind of afraid and I took antibiotics, Z-Pak. Unfortunately, that was not the right antibiotic, and I got really sick after that. And I mean, it was really bad. So they told me that if I didn't go to the hospital that I might die. And I told them I wasn't going to go to the hospital. They put me on Levaquin, and that drug, as Z-Pak does, and this is my personal experience, and you can read the inserts inside these antibiotics, read the inserts and find out the side effects. But I developed a cardiac arrhythmia. My heart rate went over 200. And I had been suffering with pneumonia. I was sleeping up on 4 pillows. I couldn't breathe. I was trying to do some, as much holistic things as I could, but which was very little because I was so extremely weak. Well, the side effects of the Levaquin and the inhaler they tried to get me to use, which causes terrible anxiety and increased heart rate, I couldn't do it. I tried it once. the prednisone, I ended up getting bruises all over my body. So I threw all the medications away. Again, they said, if you don't go to the hospital, you're probably going to die. And I decided, as a nurse, my choice would be to die at home. And that's when I went really completely holistic. And I mega dosed on some things, and I stayed within the limits. A lot of people don't believe or feel it's unsafe to take essential oils orally. I've actually been doing that for 15 years. There's a way to do it. There's a way to do it safely. You have to look at the bottle, and if it says the word ingredient on it, you cannot take it internally. If it says the word supplement on it, you can take it internally. And the company that I've been using for 15 years, which I'll put a link down below to, where you can get it at wholesale if you like. I was doing it every 4 hours. And I was also doing some of the techniques that I'm going to talk about in the video here. So I did all that, and within 2 days, I was about 50% better. It took a couple more days, but I knew then that even a person that takes care of themselves and eats right and everything, that the stress level can and will lower your immune system, and you can get sick. And so I went through that, and I said never again. So the main thing now is to do the prevention. And then if you do happen to get something, is to, I could say the word treat, I'm an RN, treat or address, I'll say, those issues. And then the symptoms won't last as long, and your body will start building immunity to certain strains. And that's what the body's meant to do. But anyway, I want to tell you that story first before I get into some of the solutions. And don't forget to hit the like, subscribe, and hit that bell so that you won't miss any of these videos. I'm doing more and more videos about these type things, especially with, the viruses going around. And I'm just getting so many questions about this. So don't forget to do that. So some of these things are just common sense. You don't need a degree in healthcare, and they're just common sense, and you would know how to use them. And then I'm going to get into, on the bonuses at the end, I'm going to get into postural drainage and how to do it, how to help drain mucus and stuff from the upper lungs and then the lower lungs, and then chest percussion. It works very, very well. One of the basic things is hydration. We have to have hydration. It does help thin the mucus. And a lot of people don't drink enough water as it is, and I understand if there's kidney issues, there's certain limitations on water, but really we need to hydrate, and we need to thin out those mucus secretions. There's other things like, don't try to stop coughing. I know coughing can be very irritating. The thing is like taking cough suppressants. I know people do that, but we have to get the mucus out. And when you do cough, it is good to look and notice the color. Is it green? Is it brown? Is it yellow? Is it white? Is it frothy? Is it thick? Is it thin? And these are all good things that, if this lasts for, I'd say, a week, or you start having other symptoms like really severe shortness of breath or anything like that, you should actually go see your physician. But thinning the secretions and not suppressing the cough are really important. And then the other thing about the cough is, I know it causes a lot of irritation, and a lot of times there's post-nasal drip. So one of the tools in the tool chest that you can use for that, you probably already know, would be gargle with salt water. And really you need to do it about 2 to 3 minutes. Don't just swish it in, and but gargling with salt water will help a lot. The other thing that will help is a neti pot. And I don't know if you've used a neti pot or not, but they work fantastic. So you put some salt in it with some warm water. You want to lean your head forward or you'll be tasting it. And then you do one nasal, you put it in one and it comes out the other. You have your head, over the sink, forward, and you would not believe the stuff that can come out. And it will clear up. It'll help with your headache if you have a headache along with this. And it just really helps You want to make sure the neti pot is clean. I know a lot of people use humidifiers, and that's fine. Humidifiers are great. That's one of the other tools, is using humidifiers, because you don't want to dry out the mucus membranes, because then your body's going to produce more mucus. So you don't want any mold or bacteria or anything growing in that. And you can use some essential oils with that as well. Eucalyptus is a really good one. There's a lot of good ones, and I'll go over some of those with you. But those are some really good things to do. Another thing is to avoid foods that actually produce mucus. Milk is huge at producing mucus. So you really want to stay away from milk. Even if you eat cereals and stuff like that regularly, I would not do it if I had a cold or the flu. Also sugar. Bacteria loves sugar. Viruses love sugar. Fungus loves sugar. So if you do eat sweets or anything like that, you really want to back off on that while you're sick. All processed foods, fast food, cheeses, dairy in general helps produce more mucus. So those are things that you want to avoid as well. So when I was talking about the neti pot, there's something else that works really, really well. There's a product, and I'm going to show it to you. And I've told any doctor I've come in contact with, or nurse practitioner, or anybody, I've told them about this product. And I have to tell you about this product because it's that good. They've done studies on it. So not only does it alleviate congestion, clean and protects, and I'm going to look at it. So I'm going to read something to you. They did a study, and they've shown where, like pneumonia, influenza, there's a couple other bacteria that absolutely will not stick to the epithelial lining in the cells in the nasal and mucosa cavity, so buccal, nasal, down through the throat. It will not stick. And the studies have showed it has worked against the virus that was here, a couple years ago. And so it also says it's safe for pregnant and nursing mothers, gentle enough for infants. And I heard about this product, and I bought, you don't want to share, I bought a bottle for each family member, and then a few for me and a backup for me. So even with the pollutants in the air and what's going on, I will spray this once a day before I go outside. If I'm around or in an area where there's a lot of people and things like that, I will use this either again at night, or I can also use colloidal silver. Colloidal silver is something that you can put pretty much anywhere in your body. It's very safe. I know there's stuff out there, controversies about it. There's a lot of stories and a lot of research done on it, and it works very well. So something else you can do is some breathing exercises. And a nurse practitioner told me this. I knew of it, but she reinforced it. There's little things inside our lungs that are called alveoli. And so we need those to stay open. We need the surfactant to let the lungs expand and contract. And I won't get into all of that because I could talk about respiratory for a year. But so what you do is when you breathe in, you hold. And I understand when you're having difficulty breathing or shortness of breath, and it will probably make you cough, but coughing is good. It acts as an expectorant to get the mucus up. And of course, it's going to be irritating, and then you want to gargle with salt water. So what you do is you breathe in and you hold. And as you hold, it helps the alveoli expand more, and it helps like more oxygen to come in and allow space for that. So you just breathe in and then you hold like this. And what you do is you hold as long as you can. You're probably going to cough, and it's just something you have to keep practicing doing. There's things we give people in the hospital, like post-op, or if they're there for respiratory issues, called a spirometer. If you have one of those that you got at the hospital and you brought it home, I suggest using that. It works really well. So you do that, and you do that throughout the day, and it actually helps build that capacity for oxygen. You want to breathe in through your nose, and when you breathe out, you actually want to breathe out through your mouth. So pursed lipped like that is the best way. But breathing in through the nose, because the nares, you know, the hairs in our nose help warm the air if it's cool outside and all that. It also helps protect from bacteria and things like that. So that's one thing to do. Another really, really good thing is, like, you can call it a vapor rub. Say people don't have any essential oils and they don't have all this stuff, and all they have, say, is Vicks vapor rub. That's fine. You can do it with that. You can do it with some of the oils I'm going to discuss. You rub it on your chest. Now, if you're using oils, you want to dilute them with either coconut oil, if you have allergies to that. Most people don't, but if you do, extra virgin olive oil. I wouldn't use corn oil or vegetable oil. They're really bad for you and they cause cancer. So you want to do a couple drops of oil, maybe 2 drops to start out if you haven't used that oil before, and then a couple drops of we call it a carrier oil, and you want to rub it on your chest or get somebody to do it for you if you're too weak. Also, you can rub it lungs. You have lung tissue going all the way up through here, down through the back. That's why the doctor, when they listen to the front and the back, right? So anteriorly, posteriorly. And you can rub it back there, have somebody rub it back there for you, and up your neck, you know, in your chest and your neck. And then some people will put a little underneath here, but make sure it's diluted. And then take some warm compresses. So we really shouldn't have microwaves, but most people do. So you can get a wet face cloth and get it wet and put it in the microwave, and then you lay it on top of your chest, or your chest and your throat. So you get a hand towel. You lay it there and it drives that deep inside, right? Or you can use a Vicks vapor rub and do the same exact thing. Front and back, and don't forget your neck. And that'll help drive it in. I do have to say that if you use even a Vicks vapor rub, that's the main thing. If you're going to go out in the morning, you really need to get it back off. The essential oils, not so much, unless you're someone you're going to be out in the sun and all that. But usually if people are really sick, they're not going to spend that much time out in the sun. Although being out in the sun for a little while, as long as there's no, a lot of wind is really bad for respiratory if you're sick. You don't want to be underneath fans or anything like that. So that's a really good tool to have, and it works very, very well. The other thing is, it works really well. Just get a pot of water and heat it up until steam starts coming out. Then you can take a couple drops of an essential oil and put it in there. And then you want to, do not get burned, okay? Don't burn yourself, but you get a towel, and this is what I did. This is what I did to recover and get over pneumonia when everything else made it worse. The antibiotics made it worse, and I really almost died. So anyway, put the oil in, the steam comes up, close your eyes, put the towel over your head and stand over it. Keep your eyes closed, and you can breathe through your nose. You can also breathe through your mouth. If it feels any irritating at all, where it's going to feel really irritating would be mouth breathing. If you do that, you can always not do that or add less essential oil. Once it's in there, you can't remove it. But let that steam come up and keep your eyes closed. The other thing I want to say about that is, if you accidentally touch your eye or something and you've got an essential oil on, do not try to wash it off with water. It'll make it worse. The only way to dilute it, and take it from me, I know from an experience with this, and I got it right. I went like that with my eye and got it right in my eye. And I mean, you want to talk about, it will burn. Then I got some of the carrier oil, which at the time I was using fractionated coconut oil, and I put a little in my eye there, and you can do that with the other hand. And then it'll actually help dissolve that. So you have to be careful when you're using essential oils, as far as touching your eyes and face, and it just happens sometimes, but never dilute it with water, because it'll make it worse. So that's just a word of caution about that. Another way to open up the airways and to break up the mucus is to get into a shower, hot shower that's steamy, and to add a couple drops of essential oil. Eucalyptus is actually the best oil to use unless you have a combination oil, and then just be in there and breathe it in and get it in your lungs. It's kind of like what mothers do for children that have whooping cough, and it works really, really well. The other thing is if you smoke. I'm an ex-smoker. I quit when I was 27 years old. I'm over 60. It's been decades. So I know how hard it is, but if you can't breathe very well, you need to not smoke. If there, any way you can not smoke, you need to not smoke. And then if you're around someone that smokes and you don't smoke and get that secondhand smoke, they actually say it's worse. And you think, well, how could secondhand smoke be worse? Well, because there's no filter. Right? They're getting the filter when they smoke. So you don't want to be around that. You want to change some of the filters in your home, right? So you want clean filters. Again, you can get like an air purifier. They make some really good ones. I'll put a link below to one on Amazon, and you can take a look around there. Thing I want to say, and I know this is hard for some people to believe when you're really sick with pneumonia or any respiratory infection, RSV or bronchitis. Allergies can make you feel like you have influenza or the flu, but is to try to stay active, get up and move around. Even though I spent quite a bit of time in bed, I made sure that every hour or so that I got up, didn't matter how sick I was, didn't matter if I coughed, I had the sweats, and I got up out of bed and I walked around, because just laying down and being dormant like that, if you didn't have pneumonia, you could actually go into pneumonia. I remember in the hospital, anybody post-op, I don't care if it's post-open heart surgery, post any type of surgery at all, the first thing we would do is get them up. Number one, it helped reduce the fever, and it prevented them from having any lung issues. Speaking of fever, and there was tests done when we had this last virus that was going around, in the beginning of 2020. And the studies show, and I'm going to give you the website, you can go and look. They actually have prevention for bacteria and viruses and things like that. I'll go ahead and mention it now. aapsonline.com, could be .org. And it's a group of thousands of doctors in our country that found other ways to treat people besides what some hospitals were doing, and majority of the people survived and are fine. So here's one of the things they found in the study: the people that were given Tylenol didn't do as well as the people that weren't given Tylenol. Well, the first thing about a fever is, when you develop a fever, that means your immune system is working. So why would you suppress that? Do you want to suppress your immune system? You do not. The other thing about Tylenol or acetaminophen is that it decreases red blood cell production. You have to have red blood cells because that's what helps carry the hemoglobin, which you need that with the oxygen, to the rest of all your organs in your body, which are all made up of cells. So you don't want to decrease your red cell production when you're having, issues that you need oxygen. So giving Tylenol or acetaminophen, people did poorly on these studies. And these are studies by thousands of doctors, have been proven. They were made out not to be, it's very controversial, but you go to that website, they have a protocol. I don't care what virus or bacteria it is, with supplements like D, zinc, quercetin, bromelain, which is in pineapple, but a lot of times we can't eat enough pineapple, and who knows if the pineapple is tainted with something anyway. You can buy the supplements for that, but great protocol there for prevention, for if you've been exposed, and then if you've been exposed with symptoms and even were hospitalized, post-hospitalization. Fantastic website. A lot of very, very good information is there. So I'm going to talk about some of the herbs and the essential oils, and they really go together because oils are made from plants and or herbs. And so when I mention it, you can use it either way. You can either take it by eating it, or you can use it as an essential oil. Don't forget to stay to the end, the bonus, on chest percussion and also postural drainage. Very, very important, and it works. So the herbs and the oils, basically, they're usually antiviral, antibacterial, antifungal, antispasmodics. They help with inflammation. They help either help get the mucus up or help with the thinning of the mucus. Obviously, they definitely help, boost our immune system so we can fight whatever it is that we're fighting. So all of these have properties. Some are more prevalent for certain diseases. So when I mention that oil or herb, I will tell you that things that they've used, and the research is there. This is evidence-based research. It's on the NIH website. You can go into PubMed and you look at all the documentation on herbs and essential oils. They're there, and this is a government website. So some I'll just mention. Lavender. We know lavender works very, very well. It actually helps too with the stress of dealing with being ill. It helps relax the muscles. Eucalyptus is a big one. I would always have eucalyptus around. Thyme, or thyme as people will say. Actually, they use that to treat COPD, believe it or not. Another thing is geranium. That's really good for coughs and bronchitis and asthma and things like that. I will tell you too that I will never be without ever in my life, and that's tea tree and oregano. Oregano is one of the strongest forms of what we call an antibiotic made on earth. Vancomycin, gentamicin can't touch it. The thing is to take it, use it, whether you're eating it as a herb or you're taking it safely as an essential oil that's diluted in a capsule, and you know how to do that. If you don't, then you find somebody like me or somebody else. They say you can take it, according to your doctor's directions. Well, the doctors don't use essential oils. Most of them don't. I know University of Vanderbilt does, and I know there's other hospitals that do use essential oils, actually. So, the advice of your doctor, they're going to give you a script for something. So, it's your choice how you want to handle it. But I will never be without oregano or tea tree, ever. And there's a few other oils, but those two for sure. The oregano definitely helped save my life. I really believe that, along with other oils. But since we're talking just respiratory stuff, I won't go into all the different oils. Tea tree is another one. Very good oil. I want to show you another product that I used that is great, and it's really good too for lung support. And say you were a smoker or you did drugs, and you need to enhance or protect or nourish and nurture your lungs. This product right here is fantastic. It's from Planetary Herbals. It's called Mullen Lung Complex by Michael Tierra. He's out of California. He's an herbalist, well-known, world-renowned, and this product right here is excellent. You can also buy the quercetin. Also, you can buy mullein by itself or do the herbs by itself. Turmeric, whether it's the herb or the oil, very, very good anti-inflammatory. And some of these I'm just going to read to you because it's just easier. So, ginger is excellent, and it's also good for your digestive system. Astragalus. I drink astragalus tea every day. I can tell you that astragalus, how I found out about it is they give it to cancer patients to build their immune system. It also helps with to increase your liver function, your kidney function, and your cardiovascular function. So astragalus tea is excellent. Elderberry is good for viral infections. Bergamot. Rosemary. One of the things rosemary in the studies it shows that it's treated with pulmonary fibrosis. And for those of you that have that or know someone with pulmonary fibrosis, it's a very challenging disease to deal with. Lungwort. Lungwort's good for bronchitis, asthma. Cardamom. I use cardamom. I had a productive cough, and not only it enhances the oxygen uptake. So that's really important when you need to breathe, right? So it also relaxes the airways. The other one's marshmallow root. It's good for any inflamed mucosal in the buccal and helps with coughing. There's just so many different herbal and used in as essential oils, things that you can do that will really help you. And I suggest doing them preventatively. I'm not saying every week. You know, you don't want to build an immunity to supplements or anything like that, but definitely, I mean, I would do it every 3 weeks. And with things going on, I will do it every week. And I just take certain supplements. Now, if I'm active with something, I will do it more than that. Definitely daily. When I was actively sick with pneumonia and almost died, I went every 4 hours. I stayed under the amount of drops that you can have for safety. But at that point, it was, either die or get better. I didn't want to forget this one. This is a Malabar root. They actually use it to treat tuberculosis or TB. So there's documentation on that. It's evidence-based. You can go to PubMed and you can look up the information, but it actually helps treat TB. It doesn't cure it, but it diminishes the effects of it. So that's, something really good to know, because a lot of things can't be cured. I do believe in healing, but a lot of things, you just have to support your body and your system, whether it's physically, mentally, psychologically, to get through what you need to get through. And with all the viruses and illnesses and diseases out there now, it's really good to be proactive. And then when we get something, then we can increase the usage or dosage of something, and then get through that. And then as our body learns the strain, then we build an immunity to that. And there is such a thing as herd immunity. I'm sure you've heard of it. And they did it in a lot of foreign countries, and it worked. But obviously, it's your choice and how you want to deal with it. And so I'm telling you some things that I have done over my 30-year career and my lifespan to help. I want to get to the bonuses on the chest percussion and also the postural drainage, but I'm not allowed to diagnose and treat. I have to say that you have to consult your doctor if you have any questions, but do your research, because a lot of them, unless they have both degrees like mine do, they have the medical degree and they have the functional medicine or holistic experience too, so they can use both. So I get the best of both worlds, and I get to practice that, and I get to teach that. And to me, that's the most important thing. I don't want the side effects of something that is going to make me more ill than I was before I took it. I'm not doing that anymore, and that's my choice. And you also have that choice. So let's get to the percussion and to the postural drainage. So before I would do the postural drainage, I would do the chest percussions. And if you have children, you probably did it on them when they were babies and they got the whooping cough or congested or something like that. So you want to do that first, because that's going to help loosen and break up that mucus. And then when you do the postural drainage, and remember, you've been hydrating, it's going to help drain that. And we've done it in the hospitals, like I said before. It used to be standard care. Things have changed over the years, but done it for myself, done it for family. When I worked a little bit of home care, I taught patients how to do this at home unless there was a reason they couldn't do it. But on the chest percussions, I'm just going to lower this a little bit so you can see as I do it. So you want to cup your hand, right? And you want to, in like a rhythmic thing. And if you can get somebody to do it, see how my voice changes? That's what you want. And you can even, like I said, there's lung tissue up through here. And so you want to get the front and get all around here, and you want to do it for like 3 to 5 minutes. And the person may start coughing, they may start bringing things up, and then you want to go to the back side and do the percussion. It's actually easier to do it on someone else than it is to do it on yourself. But, you know, if you live alone or you don't have anybody to do it for you, obviously you have to do it on your own. So you want to use that rhythmic thing and cup it and vibrate that chest and vibrate those lungs and help loosen that up. It clears your airways and it makes it easier to breathe. It might not feel like that when you're doing it. I know when I worked ICU, I would do it for my patients, but respiratory, when they would come in, they would also do, they call it cupping. They may say chest percussions, but it works and it will loosen it up. So now let's get to the postural drainage. So what you do is when you lie down, you can lie, a lot of people lie on their back. They find it easier. I actually find it easier if I lay on my stomach, frontal. So one's prone and one's supine. Supine is on your back. So you're on your stomach or your back, whatever's more comfortable for you, or you could do both. And you lower your head. And as you lower your head, what you're actually doing, you're helping drain your upper lungs, right? So do that, you know, if you're not alone, that would be good to have somebody there with you, but you can do it alone. I've done it alone myself many times. And then let that drain and, you know, have some tissue and stuff by, because believe me, when it comes out, it's going to come out, especially if you've been hydrating and doing all these other things that we've been discussing. And then to get more of the lower lungs, you want to turn to your side. So side lying, you know how you can sleep on your side, you're sleeping on your left side or your right side. And I suggest doing both sides. And then lower your head. You want to kind of be like this. It's hard to do on a bed, but you can do it. I know people that have those tables, those inversion tables, but I wouldn't suggest doing that just because of other issues, other things that could happen. There may be things going on with your spine or something like that. So that postural drainage, and remember, front, prone, or supine line on your back. Your head's going to be below. Have some tissue and a wastebasket there, and let it drain. And then the other thing is side line. So you're going to lie on either side, and that's going to help drain the lower lungs. And it works really well after you do your chest percussions or your cupping. We call it that, cupping as well. And like I say, stay hydrated, and it works really well. So I hope some of this information has helped you. I've shown you a couple of products, and I'll leave the links below. Work great. I'm telling you, they work great. Told you about the website, aapsonline.org. So again, here's some more tools for your toolbox. I've introduced some products that you may or may not know about that have been just excellent, and not just for me, but for others that I've spoken to about. Different techniques that you can use, where you're using essential oils, herbs, vapor rubs, changing the filter in your house. There's just so many things that you can do to prevent, number one, but if you get something and come down sick, and it seems like there's another variant out there and things are just gonna go south for some, but if we can pass around the tools and we can share our information with each other, and if you have anything that you do that I didn't mention, and there's a lot I didn't mention, or this would be a tremendously long video, I just try to hit on some key things and some simple things that you could do to help yourself. Obviously, nutrition is key, rest, good water, exercise, or just movement. And that'll go a long way. So again, this is Nurse Kathleen. Don't forget to hit like and subscribe and hit that bell so you don't miss any more of the upcoming videos. I really, really appreciate your time. I really appreciate your support. I pray you don't get sick, and if you do, the duration and the intensity will be very low, and that this information will help you. Thank you again.